functional medicine or functional healthcare, functional integrative medicine. I've interviewed quite a few functional medicine doctors on this podcast before, and all of them sort of point towards the same direction. And this is what I understand, and please correct me if I'm wrong, is that what you guys do is essentially take all these different areas and feedback into consideration, but really figure out what the root cause is and then address the root cause. Is that a correct understanding of functional medicine?
True but partial. So I'm going to reframe it because I think functional medicine has lost its way. And I'm going to talk a little bit about what should be functional, or what it traditionally was, and the difference between functional medicine and functional nutrition. So functional medicine, like integrative medicine, was really born in the 1990s. People often want to know what's the difference between holistic and integrative and functional. So holistic's just a big umbrella term. Integrative means we acknowledge different types of therapies. So yes, you may be going to the oncologist or the rheumatologist, and you're also thinking about your nutrition and your acupuncture and your stress reduction. So you're integrating different approaches. A functional approach was designed to really honor three primary tenets. Those three tenets are the therapeutic partnership, looking for the root causes, and I'm going to put an S on that root cause, and a systems-based approach. So that therapeutic partnership really acknowledges that the patient brings an expertise to the room, and we want to understand their story. As you said at the beginning of our time together, we love stories. The story is a really important part of how we work with that person, and we don't ignore that story. And there's a scientific way to look at it, as well as an empathetic way to look at it. So the therapeutic partnership is one tenet. Looking for the roots is understanding why is this happening, not just what do I do about it. So our current medical system, which we need and which does really important intervention, looks at protocols. What do we do based on XYZ? We're saying, why is XYZ happening? Why is that? What's going on upstream? And I have a system that helps us to think about that. And then a systems-based approach is acknowledging systems biology. So instead of thinking in the realm of ologies, like your endocrinology, your rheumatology, your gastroenterology, your psychology, we're saying, wait a minute, everything's connected. It's a full body systems. The gut's connected to the brain. The hormones are connected to the liver, which is connected to the gut. It's all connected. We can't look at your structure without looking at your inflammation, which is affecting your immune system. Everything's connected. So my mantra based on that is everything's connected. We are all unique and all things matter. And that embraces the realm of omics, precision medicine practices, and epigenetics. So it's related to fields of science that are informing how we then behave in practice. And then the difference between functional medicine, that different? Okay, I'll stop there.
No. I was going to ask more clarification question, but if you have any more to add to that, please finish your thought.
Yeah, I was just going to say the difference between functional medicine and functional nutrition are the tools in our toolbox. So functional medicine doctors usually recognize the importance of dietary and lifestyle modifications. They may not know how to deliver dietary and lifestyle modifications. Dietary modifications are not a handout. They often take a real deep dive into a person's cultural background, their relationship to their body and to food restriction, and really understanding who is this person and what's the right evolution of change for them. So it's not behavior change like health coaching might be, but it is recognizing the truth of the individual in our recommendations at a more minute level of implementation into the everyday than often a functional medicine practitioner has time for.
So functional nutrition falls under that? Sort of part of
yes,
functional.
Exactly.
Yeah, right.
Yes,
so
all
it's a tool.
Dietary and lifestyle modification. Yes.
Yeah, I love it, and I would love to reaffirm what you just said about how everything is interconnected. the whole body is a huge system that talks to each other. One thing goes wrong, other things may overcompensate and go wrong as well. I talk about that all the time. Metabolism is more complicated than a straight line, a straight equation. And the second thing is that you mentioned we are all unique. So everyone is the same in the sense that everything within our bodies are interconnected, but everyone is unique, and therefore we need personalized medicine. And here we go. Now we need more clarification and definition for our audience. You mentioned the three things: omics, precision medicine, epigenetics. Can you please elaborate on what those three terms are?